Namaste, beautiful audience. On behalf of Yoga Scholars, PGIMER, today I want to introduce our Sri Lankan guest, Dr. Priyadarshana. Priyadarshana is a professor at Postgraduate Institute of Pali and Buddhist Studies, University of Kelaniya, teaches Buddhist psychotherapy, Buddhist philosophy, Buddhist counseling, Buddhist civilizations, and yoga. So today he will speak on Buddhist psychological review on counseling, psychotherapy, and psychiatry. So most welcome, sir.
Namaste. Good evening, everybody. Good evening, everybody. I'm Professor Wasantha Priyadarshana from Postgraduate Institute of Pali and Buddhist Studies, University of Sri Lanka, University of Kelaniya, Sri Lanka. Well, today my topic is Dhamma therapy, a Buddhist psychological review on counseling and psychotherapy. So as far as Buddhism is concerned, it really talks about two things. One, the first thing is really suffering, dukkha. The second one is its cessation. In short, Buddhism talks about psycho and somatic sufferings as well as their cessation. So when it comes to Buddhist psychology understands that all kinds of psychosomatic sufferings are really originated from within the psychosomatic aggregates. In short, we understand the psychosomatic aggregates as individual forms, which mean rupa, feelings, vedana, perception, sanya, mental formation, sankhara, and consciousness. In Pali, Vinyan. So as far as these five aggregates are concerned, that is the individual. In other way around, we understand that is the internal world, or it becomes the samsara. So as far as these psychosomatic aggregates are concerned, this is the origin of all kinds of psychosomatic suffering. So then Buddhist psychology says that if the psychosomatic aggregates are the origin of the all kinds of psychosomatic suffering, then the treatment should be given, the therapy should be given to this context. It means the five aggregates, psychosomatic aggregates. So when Buddhism suggests that the treatment should be given to the psychosomatic aggregates, then what is the treatment? What is the approach? Actually, Buddhism introduces only one approach, ekayana magga, according to Satipatthana Suttas. There are two Satipatthana Sutta. One is from Majjhima Nikaya, other one is from Digha Nikaya. So these Satipatthana Suttas explain the only way as the meditation, mental culture. So the mental culture or the meditation should be given to these psychosomatic aggregates. So then what is meditation? Actually, when it comes to the Buddhist psychology, meditation is of threefold components. The one is sila, the second one is samadhi, third one is panya. Sila means really morality. So this morality or the sila expects to bring a kind of behavioral transformation to the individual. So this is the foundation. Sila is the foundation of meditation. Without sila, it is impossible to talk about kind of meditation in Buddhist psychology. So there's a sutta called Kuta or two-storied or three-storied building from the Samyutta Nikaya. That Kuta Sutta explains that without having a strong background foundation, so it is very difficult to have the strong wall as well as the roof. So then it's mean the foundation, the strong foundation of Buddhist meditation or a meditation becomes the sila. So sila expects to bring about kind of behavioral transformation to the client or to the client. the patient. So without having a kind of positive behavioral transformation, it is very difficult to provide emotional transformation to the client or the patient. Emotional transformation is expected to bring out through the concentration meditation or vipassana, or in the other way around tranquilized meditation. Without emotional transformation, it is very difficult to bring about a kind of cognitive transformation. The cognitive transformation is really expected from Buddhism through uh, panya or wisdom, or in the other way around we call satipatthana. Satipatthana. So in Buddhism, there is kinds of insight meditation. So then these emotional and cognitive transformation are really based on the strong foundation, which is known as sila. Then what is this sila? Actually, sila becomes kind of strict code of behavior. So in Indian psychology, as far as all the Indian religions are concerned, there's a very strong basis for the psychology. So we can say that Indian religious psychology, these psychologies highly emphasize the strict code of behavior for the patient or for the followers. So this kind of strict code of behavior through the sila really uh, sila brings about a very positive behavioral transformation to the person. It's very important, very significant. So when it comes to Buddhism, there are kinds of 5 precepts, 8 precepts, 10 precepts. It's a kind of practice. It's a kind of practice for the lay people or for the monks or other followers. So anyhow, when we are having a strong adherence to kind of strict code of behavior, it really brings kinds of very healthy as well as positive attitudes for the patient or for the client. For example, when it comes to Buddhist psychology, there's a story called King Ajasat. Actually, he was suffering from kind of moral anxiety due to his patricide acts. So as the way to get rid of these kinds of issues, what Buddha really explains there is the sila. So according to modern neuropsychology, neurosciences, they also talk about the brain is plastic. Actually, Buddhism gives really the final place for the really brain. When it comes to the loathsome meditation, the actually brain is understood there as the last point, mattake mattalunga. So there will be a kind of issues why Buddha has given the final, the last place for the brain in Buddhist psychology. It means that Buddhism doesn't refuse the brain, but Buddhism highly emphasizes that mind uses the brain to make the mind. So without mind, brain becomes only a muscle component. So in this point, what the Buddhism highly emphasizes is that through a kind of strict code of behavior, really, we can change the brain. For example, there is a story in Buddhist psychology, serial killer Angulimala. What really Buddhism suggests for this serious killer? If he is all ready to accept a kind of strict code of behavior, so we can, Buddha says that yes, he can be, this serial killer can be really healed. So Buddhism highly emphasizes here actually sila as the strong foundation for the meditation and yoga practices. So the important thing is when it comes to the Dhammapada says that water engineers, they know how to channel the waters to their land. And the carpenters, they know how to change the hard wood into very fine, beautiful furnitures. In this way, the person who is going through really a kind of strict code of behavior, he can really change his brain, unhealthy brain, into kind of healthy brain. So sila is very important in this sense. Actually, what the neuroscience, psychology explain is that brain is plastic, and they talk about kind of neuroplasticity According to Buddhist psychology, when a person is have a strong adherence to kind of this sort of a strict code of behavior, and he has to continue this for a certain period. As a result of going through this kind of certain periods, this sila, this morality, this behavioral transformation really brings about kind of healthy mental attitudes to this person. This behavioral transformation with strong healthy mental attitudes, this aspect really supports for the client or the therapist to start to change his mind into kind of emotional transformation. So for the emotional transformation, what Buddhist psychology introduces is really concentration or a samatha. When it comes to Buddhist psychology, as far as the Buddhist psychology is concerned, we know that actually samatha or a tranquilized meditation really talks about how to transform the human mind to highest level in accordance with Buddhist mental topography. There are three levels in human mentality. The first one is really sensual sphere or kamavachara. Second one is fine material sphere. Third one is immaterial sphere. If someone wants to develop, enhance his or her mind to the utmost level, there are supramundane levels, as well as when it comes to highest Buddhist psychological principles. Buddhism talks about kind of concentration for cessation of perception and feeling, sanya, vedita, nirodha, samapatti. So these concentration meditations actually explains that when a person enhances his mind from a low level to the utmost level, he even access into kind of optimal psychological potentials. With regard to this optimal psychological potentials, he will really achieve meta psychological abilities, clairvoyance, telepathy, in accordance with modern parapsychological elements. They really talk about such things. But according to Buddhist psychology, they are not really they are not really beyond the extrasensory perception. They are really not belong to the parapsychology. They are really belong to this pathong-long body. According to Buddhist psychology, the world is within this psychosomatic element. Imasming behama matti mi kalebare. The world is within this pathong-long body. So these meta psychosis abilities, these kinds of psychological potentials are really within these psychosomatic aggregates. But the problem is that human beings, the people, they have not been provided kind of sufficient knowledge. So that's why they don't know how to evolve, how to enhance their abilities. But when a person is given or provided some sort of necessary knowledge, they know how to transfer their sensual desires, delusion, ignorance, fundamental misknowledge into kind of highest level. So for this purposes, to acquire kind of higher psychic energies, optimum cognitive capacities, Buddhism really introduces kinds of concentration meditation. After having this sort of concentration meditation, after reaching to this sort of highest level, then Buddhism really introduces insight meditation or mindfulness practices. According to Buddhism, according to Buddhist psychology, these kinds of mindfulness practices are really explained with four elements: kaya anupassana, mindfulness on body; vedana anupassana, mindfulness on feeling; chitta anupassana, mindfulness on mind elements; and Dhamma anupassana, mindfulness on spiritual elements. So actually, when it comes to this satipatthana practices, vipassana practices, or insight meditation, it also follows a kind of hierarchical process. The first step is really kayanupassana. It means the mindfulness on body. First of all, the client or patient has to bring his consciousness to his body into present context. According to Buddhism, the patient's mind goes here and there. According to the Bhadde Karata Sutta of the Majjhima Nikaya, it says that the patient, the client's mind is either in past or in the future. His mind has not come to the present moment. So we have to bring his mind to the present moment. To bring back the mind into the present moment, Buddhism suggests a Zen, really mindfulness on body. That's very important. When a person can get his awareness to the present moment onto his body, actually it's supposed to reduce his stresses. So with reference to the modern psychological analysis, we know that really they talk about simple muscular relaxation, deep muscular relaxation. But when it comes to the mindfulness on body, it's really supposed for the person, supports for the person to have a kind of relaxed body. So when it comes to modern brain sciences, we know that they talk about true brain, kind of lizard brain, the limbic region, as well as neocortex. So according to the Buddhist meditational practices, the first practice that is really mindfulness on really the body supports for the person to have a kind of relaxed body. It's supposed for the person to switch off the lizard brain. So lizard brain is really responsible for our survival tendencies, heartbeat and breathing and body temperature. When a person is not really balanced with this kinds of aspect, he really becomes a kind of patient. But Buddhism supports for the person to reduce these kinds of tensions and to have a kind of well calmed down balanced body. So according to Buddhist psychology, there is a reciprocal combination in between the physical muscles body and the psychological body. There's a reciprocal interaction. So Buddhism doesn't support to any kinds of dualistic aspects. Buddhism all the time see this interaction. But even though Buddhism accepts the interaction in between mind and body, Buddhism gives the priority to the mind. So without consciousness, without mind, brain becomes only a muscle part. So in this context, Buddhism really, in Buddhist Dharma therapy, Buddhism really emphasizes, Buddhism really provides so significant, prominent place for the mind. So there are some examples in Buddhist psychology. Once a patient named as Nakulapita, he was totally physically disturbed. And he asked from the Buddha kind of treatment. Then Buddha says that try to train your mind to highest level. So when you have enhanced your mind to highest level, in that level, your mind is not ill, even though your physical body has been already afflicted. So Buddhism all the time encourages people to acquire kind of developed, enhanced mind. With that mentality, they can face with kinds of physical illnesses as well as psychological illnesses. So to have that kinds of mentality, Buddhism really suggests the concentration meditation as well as insight meditation. It means mindfulness practices from the insight meditation. So significant point from the mindfulness on Kayanupassana is it's really provides counseling and psychotherapeutic knowledge guideline for the individuals how to have a relaxed body at first. Then secondly, when it comes to the mindfulness on feeling or feeling-based meditation, it gives the knowledge for the patient how to have emotional, how to have a balanced emotional mechanism. If we are not emotionally balanced, so we cannot properly talk. We cannot have properly language abilities. We cannot communicate properly, as well as our family and social life will go down. So balanced emotional mechanism is very important. So such things are really discussed in the modern neurological sciences as the limbic region. These things are related to the limbic region. But when it comes to the Buddhist psychology, even though Buddhism has not discussed directly kinds of brain sciences, but through the Buddhist mind psychology, through the religious psychological principles which are derived from Buddhism. Really, Buddhism has talked about all the brain sciences. Then when it comes to the next one, that is the mindfulness on mind elements, it's a very significant point. What is the significant point is that without having a calm, balanced, settled down mind and emotional mechanism, so we cannot look at, we cannot explore our mentality, our consciousness, our mental schema. So when it comes to the Chittanupassana, mindfulness on mind elements, mean it provides the knowledge for the individual how to look at your own mind with mindfulness. So this is the real meditation. So without having well calm balanced mentality, we cannot really see, we cannot really understand how our mental schema, how our mental elements are working. So it's very important to have mindfulness. With the mindful mind, with the well-balanced mind, we are really look at mind. According to the Buddhist psychology, there is a sutta called Pansudovana Sutta. In this Pansudovana Sutta, it talks about 3 levels of the mind. The gross form of the defilement, how to look at the gross form of the defilement, then moderate form of the defilement, and very subtle latent defilement of the mind. So without having well-balanced mind, without having mindfulness, so we cannot look at the mind. When a person have a good training practice to look at his own mind, it means that then he himself can recognize what are the symptoms, what are the causes that lead to have kind of psychological issues. So such issues are really recognized as a tree signature, or sorry, such things are really recognized as desire, hatred, and delusion or fundamental misknowledge. So to look at, to understand these defilements and their function, we need to have a kind of well-balanced mind. After recognizing such things, then we have to eliminate these sort of causes, unhealthy mental attitudes. In order to eliminate these sort of unhealthy mental attitudes, we have to develop spiritual qualities. So what is really meditation according to Buddhism? So according to Buddhism, Buddhism says that the development of the kusala dhamma, the development of the spiritual qualities become the bhavana meditation. So what are the spiritual qualities? So spiritual qualities really become these 7 enlightenment factors. Among these 7 enlightenment factors, mindfulness become only one part. This is very important. So when it comes to the Kuta Sutta or story building sutta of the Samyutta Nikaya, it says that very significant point for the modern mindfulness practices. What is that point? It says that mindfulness is not the solution for every issues. Mindfulness is only one aspect of Buddhist meditation. So when it comes to the Sabbhasa Sutta, how to eliminate all kinds of cankers, it explains 7 approaches. The final one is the bhavana. In that point, it doesn't talk about any kind of concentration meditation or insight meditation, samatha vipassana. It directly talks about with enhancement of the spiritual qualities become the bhavana. So among that spiritual qualities, mindfulness is really on one aspect. But as far as nowadays mindfulness practices are concerned, there are a lot of kinds of criticisms and issues. So there are kind of sudden ways and means to bring about sudden cognitive transformation for the patient, for the client. But the important thing is that without having a strong basis foundation, what we call as sila or behavioral transformation, and without having a strong wall, it means the samatha concentration meditation, these strong walls becomes actually, these strong walls provide psychic energy, optimal psychological abilities, potentials to bear the roof. Strong roof becomes the cognitive transformation. But when it comes to modern mindfulness practices, there are shortcuts, there are short ways and means. Suddenly they can really provide the cognitive transformation for the client. But do remember that Indian psychology all the time highly emphasizes a gradual process for the mindfulness, gradual path, anupubhi. So the mind is to be enhanced. Mind is to be developed uh, through this really kind of gradual process. Without the gradual process, if someone tries to bring about sudden instant cognitive transformation, so the client, the patient cannot bear it. So how to bear this strong roof? So this kinds of sudden cognitive transformation will bring back the client to some kinds of unbearable relapse, very serious. So nowadays, with reference to the mindfulness practices, meditational practices, and dealing with these meditational practices with kind of neuroses or psychosis issues. So nowadays we see a lot of kinds of problems, issues have been really occurred. That's the reason. The reason is the lack of knowledge of this gradual process. So why we really introduce this topic as Dhamma therapy, Buddhism, with the strong basis of Indian psychology, explain two approaches. The first approach is emotional transformation for the client to the samatha, then cognitive transformation to the vipassana to the client. If we really provide this sort of knowledge, this sort of psychological knowledge for the client, so we can really treat him well. For instance, as far as the field of counseling is concerned, it really deals with less disturbed problems. When it comes to the Buddha's spiritual career, Buddha has really dealt with less disturbed problems of the people. So for educational issues, family issues, vocational as well as professional issues, so Buddha has really provided the psychological support for that kinds of issue. In that sense, actually Buddha is recognized there with a very strong epithet at Bisakka. Bisakka means general physician. So general physician directly provides the medication for the client. So Buddha also has provided kind of direct supports for the less disturbed issues. When it comes to the psychotherapy, actually psychotherapy deals with so serious psychological issues, more serious psychological issues. In that sense, Buddha has been recognized as Sallakatto. It means the surgeon. Surgery is not easy task. So Buddha also has dealt with kinds of so serious psychological issues when it comes to the Sallakatta suttas. So such suttas provide how Buddhism has dealt with so serious psychological issues when it comes to nowadays problems. So we can really suggest that Buddhist psychology can be introduced to deal with terminally ill issues, cancer patients, psychological issues, geriatric issues. There are kind of serious psychological issues. So when it comes to Anatha Pinnikova, the Sutta Buddha really talks there how we can use these Buddhist psychological principles to the psychosomatic aggregates to eliminate serious psychological issues. When it comes to the serious killer Angulimala, actually Buddha suggests the gradual path for the Angulimala, the person who worn up the garland of the human fingers. He had the antisocial behavior. So the thing is that when we are slowly read the Angulimala Sutta, we can see how Buddhism has suggested Dhamma therapy, which is based on really behavioral transformation, emotional transformation, and cognitive transformation all together. This process become meditation. So meditation is really of three components. These three components really supports for behavioral, emotional, and cognitive transformation for the client. For in that sense, Buddhism can be recognized as a Dhamma therapy, Dhamma patikara. This Dhamma patikara really can be introduced to enhance the repertoire of repertoire of the tools of modern psychotherapy and counseling elements. These are the things that we have to really discuss today. So if there are any kinds of questions, so the time is up to you. So dice is up to you. So we can have a chat. We can have a
Thank you,
discussion.
Dr. Priyadarshana,
Yeah.
for a very nice and very incisive talk to our audience. And you are also joined by some of your scholars from Sri Lanka.
Yeah.
A question that comes to our mind is about its integration with the healthcare.
Yeah.
Now, a patient of cancer, or let us say a patient of coronavirus infection,
Yeah.
is going through tough times,
Yeah.
already mentally engrossed.
Yeah. Sure.
How can Dhamma therapy or maybe the
Yeah.
Buddhist,
Yes. Yeah.
the
Yeah.
psychological
It's
counseling,
very. Yeah.
it
It's
is
very clear.
it is
It's very
difficult to
clear.
work because mindfulness will require attention and a calm mind, not a diseased mind. So,
Yeah. Yeah.
what is your comment on that?
Actually, my comment is really when it comes to dealing with this sort of sicknesses. Actually, there's another chapter in Buddhist psychology, but the thing is really something is happened due to manifold causes when it comes to this corona COVID issues. Actually, it's a kind of burning issue. But the thing is that the first thing is really that when it comes to this sort of issue, the person, the client, or the people, so they are to be given a kind of knowledge. What is this really the issue is at first. It's very important fact when it comes to the Buddhist psychology. Buddhist psychology really explains that without having a proper understanding of the issue, so we don't know how to get rid of that issue. So with reference to the corona issue, to get away from this issue, really we have to keep social distance. So such things, the measurements to prevent the measurements to prevent this issue are to be really founded out from a kind of really insightful transformation. So the first thing according to Buddhism is that the client, the people, actually they are to be given kind of knowledge. When it comes to the Buddhist psychology, I see that there is one approach in Buddhism, that is cognitive behavioral transformation. As a whole, when we concern Dhamma therapy as a therapy, it really provides a cognitive behavioral transformation. So we cannot really, for a verification, we can say that there is sila, samadhi, and panya, but such things have to be provided together. So when it comes to this issue, COVID-19 issue, so the thing is that first of all, the people, they have to be provided kind of significant. So after providing this knowledge, so they have to be mindful. Without the mindfulness, so they cannot go away from the causes leading to the COVID issue. So how to keep the social distance? So without mindfulness, so we have to use some sort of sanitaries, and then we have to all the time wash our hands. So when we are touching the material things, if we don't have the mindfulness to keep the distance, so we are really caused by that sort of issues. So the behavioral transformation in this context is to be founded out from the sufficient knowledge. That's my answer here.
Yes, but I was asking about the mindfulness of a infected patient. Now he's infected, she's infected.
Yeah,
How
yeah,
in an infected state, when
yeah,
there is tension and fear of
yeah,
death, or how to practice mindfulness at
yeah,
that time?
that's good.
Mind
Yeah,
is wavering.
yeah. The thing is really in this context, when the patient has been already infected, this sort of serious issue, in this context, actually the thing is that he is to be given kind of actually the medication. That's the behavioral transformation what Buddhism suggests. Buddhism all the time doesn't suggest the mere things. In that context, the medication is to be provided. While we are providing the medication for already infected person, then we have to gradually enhance his uh, spirituality. So the gradual transformation for the enhancement of this patient mentality is very important. In this context, what Buddhism really suggests is that as we concern about the cancer patients too, he is totally infected from the cancer. In this context, for example, I will give you a very good, insightful example from the Buddhism that is really Dhananjani Sutta. In this Dhananjani Sutta, there is a patient called Brahmin Dhananjani. He is really in the death bed. He is really dying. In that context, Venerable Sariputta comes, and really what the Venerable Sariputta applies here is that he knows that he is dying now. So in this context, very significant point is that we have to transform his mind to some sort of higher certain levels, and we have to introduce to accept the death. But in this context, what I really want to explain you is that the mind can be really enhanced even though we are physically infected. So the very important thing what the Buddhist psychology understand is that the example comes from the Napulapita Sutta, clearly says that there is a energy, psychic energy in the mind, even though your body is already afflicted, but if you really enhance, because mind can be enhanced when the therapist knows the way clearly, he can really uses these techniques from how to emotionally enhance, how to cognitively enhance. So with reference to this Nakulapita and Dhananjani Sutta, we see that Buddhism uses four sublime abodes we call loving kindness, compassion, altruistic joy, and equanimity. These are the seeds. Everybody has these kinds of seeds, belong to the intrinsical nature of the mind. So if the person knows the way how to energize us, how to energize that sort of mind seeds, spiritual seeds, so we can develop. This is the point what Buddha suggests from Anatha Pindikova and Nakulapita, because even though Buddhism understands that there is an interaction, reciprocal combination in between mind and body, but Buddhism understands that mind can really change the body. So the thing is that there are three hermes: flame, bile, and air. These things are really interconnected with desire, hatred, and delusion. When we emotionally, when we emotionally change our client, when we cognitively change our client's mind, this transformation of the mentality really affects to change the physical elements of the patient. For example, when it comes to the Girimananda Sutta, so Girimananda, Venerable Girimananda was highly infected. He was highly disturbed by the physical diseases. But what the Buddhism suggests here, Buddhism doesn't refuse the medication, but with the medication, what the Buddha really suggests that the important thing is that you have intrinsical energies of the mind. When you develop this intrinsical energy, seeds of the mind, these seeds really effect to change the body. That's the Buddhism understand the issue.
Very nicely explained, very coherently explained. I will invite the people who are here, Kamani, Nanda, or Prashant, if they have a question to Professor Priyadarshana, they may ask now.
Yeah, good.
If they have questions like Ashtanga Yoga and its relation to any of this, or whether you can do meditation without mindfulness. I'm just leaving some cues for Prashant or Kamani or Nanda.
Sir, what are the similarities in Ashtanga Yoga and this Dhamma Yoga, Dhamma therapy?
Actually, in the sense, as far as the yoga are concerned, yoga is not really the physical exercises. It has very strong, the deep-rooted psychology.
Yes.
So then I think you know all that thing. So my point is that the yoga, as far as the subject, the discipline of the yoga is concerned, it also has this link. So according to my studies, I see that how yoga suggests to change the behavior at first, really. So these all subjects are really centered on Indian psychology in our universities. The Department of Western Psychology, the Department of Buddhist Psychology. So in Sri Lanka, they are really introducing a very interesting subject for the students, those who are following psychology, as Indian psychology. Indian psychology. In this Indian psychology, we have already added the Veda, Rig, Yajur, Sama, Tharvan, and Upanishad, and Sankhya Yoga, as well as Jainism and Buddhism. So in that context, we actually provide the knowledge for our students how these yoga, Jainism, Buddhism, and Upanishad, what are the strategies they have really introduced to change the behavior. When it comes to the yoga also actually when we are practicing kinds of you know the asana at first, when we are practicing asana, actually these asana firstly provide the thing. Actually the important thing is that we have to practice this asana for a certain period. After practicing this asana or yoga for a certain period, it really brings kind of a transformation to our physical as well as verbal function. So at the very beginning, we cannot bend our arms, but when we are having a strong adherence to this, it really provides us how to change, how to bend our bodies and so on. Not only that, it really changes our verbal, our physical functions, as well as our mental function. The important thing is to practice it for a certain period. That's very significant. So actually, when it comes to the yoga and Dhamma therapy, regarding the strategies what both disciplines introduce to change this behavior and emotional and cognitive, I see the similarities, but they have different kind of strategies. When it comes to the Buddhism, it really concerns the meditation, but when it comes to the meditation, it is of, as we discussed, threefold. But when it comes to the yoga subject, yoga philosophy provides a lot of kinds of physical exercises. It provides a lot of kinds of the ways and means to how to use the foods, and it really explains how we can really use this yoga to enhance our day-to-day activities and so on. But in my understanding, according to my understanding, Dhamma therapy and yoga, they have this gradual transformation. It's mean behavioral, emotional, cognitive.
Yes, sir. Yes, sir. Okay, sir. Thank you, sir. It's a nice meeting, and thank you very much for sharing your views on Dhamma therapy.
Welcome.
Okay.
Thank you very much
Now,
for this opportunity.
okay,
Thank you.
sir. Thank
We
you.
will
Sir.
reconnect again. Thank you very much.
Okay, thank you very much, sir. Namaste, sir.
Namaste, namaste.